Welcome to Soft Bites Podcast, your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello, everyone. Welcome. Welcome
Hi,
to.
Manuela.
Oh, hello, Andre. How are you? Everything is good?
Yeah, it's fine. The summer is starting, longer days, so it's always a positive thing at this time of the year.
It's
How
a
are you?
different vibe in summer. Yeah, I'm good. Also, it's good weather here. Also, and it was a nice couple of days. I had the chance to rest because it's been a I had some busy weeks. So now this next 2 weeks it's going to be calmer. I have a lot of things to prepare, including our course that's going to happen in October. So yeah, I'm looking forward for some slow time. That is, I'm really in need of that, and I'm very happy to be here with you again. And this is episode 5 of our second season, and so we never prepared this episodes. It's completely freestyle, our conversations. But today I propose to you for us to talk about something, because I was going through the program for our course in October, and I was going through my notes, some notes that I took from our first edition, and I was looking at something that I know that you give a special attention to, and that I know that you also in your courses, it's something that you teach to your students, and I think that it's something that it's not. Um, I think that every dentist know the importance of it, but it's not something that every dentist do at their everyday dentistry practice. And because I
Hmm.
consider it to be very important, and because I know that you also have a protocol for this, and this is something that it's very well implemented in your clinic, so I propose to you for us to talk about the initial examination. Not only for you to share your ideas and how you do it, and how you and your team in your practice do it, but also about the importance, about the consequences of doing these initial examinations, and also for us to talk a little bit about how that builds also connection and trust with the patient. So, how what is for you the importance of the initial examination in dentistry? Tell me.
This is a very dear subject to me because I really give it a lot of importance, and I think that we have been doing this protocol of initial examination in my practice for, I would say, maybe, I would say maybe more than 15 years now. More than 15 years now. And initially, I started to do the initial examination because my friend Alok, who has been on the podcast as well, it was basically when he was coaching me about practice management. He had a lot of training with a guy from US, from the Pankey Institute, Frank Spear, John Coyce, the philosophy of Peter Dawson, which is basically a group of American dentists that really invented what is interdisciplinary dentistry, um, interdisciplinary or rehabilitation, and everything that we study today, all the mechanisms of occlusion, of how you blend all these specialties together. It came from those guys, and so I started to implement it. I have to say that initially I wasn't very aware of how transformative that the implementation of the initial examination is. I wasn't really aware of that. And we kept doing it, and being more refined. And we we started to be less tolerant with mistakes. And what do I mean by mistakes? People that get into the practice and don't pass through the initial examination. We start to be less tolerant with that. So I would say that 99% of patients that go into my practice, in the first or in the second or third appointment, they do an initial examination. And in the beginning, I wasn't really aware of, like I was saying, how transformative that was, until I started to refine it and refine it and refine it, and it allowed me and my team to be able to organize what actually, in my point of view, should be a dental practice. And sometimes because I think that you've heard me talk about this, I am very enthusiastic and very bold when I talk initial examination, and I am very. Um, I think it's something that really can change your practice. Um, and sometimes I think to myself, well, maybe I am exaggerating. Maybe this only works for me because I have this practice that I want to do things right. And maybe what I'm talking is something that does not sound so familiar or so important to the average dental practice. But then I started to think, okay, so what is an average dental practice? I mean, an average dental practice today has more than one specialty. And if you work alone, if you work alone in one practice, you probably won't need an initial examination. I mean, you still will need, but it's not as important. But if you have someone that works in your practice, if you have an orthodontist, if you have a prosthodontist, implant surgeon, a periodontist, which is extremely common now, I don't think there is really any other way of managing what we call the patient flow, which is the way that the patient circulates um, from appointments. I think that there is no other way of setting a start.
Mm-hmm.
There really is no other way. So I don't think that for some time I thought that, well, this is maybe not that useful, but now the more that we do it and the more experience that we have doing it, I really think it's the pivotal change that you can do in your practice where everything else can happen. So as you know, I'm a big fan of systems, and again, systems are one of those things that you don't need them if you work alone, but if you have an assistant, you need a right. And
Mm-hmm.
even if you work alone, you need a system. So the center of the system really is the initial examination. You cannot have protocols and systems and workflows in your practice if you don't have the initial examination. So there's just so much things to say about initial examination, which I'm sure we'll talk about. But one thing that really resonated with me was I've read an interview of Peter Dawson, which again is one of the guys from that group of American guys that invented what is interdisciplinary dentistry. And by the way, I think there is no more unidisciplinary dentistry. I think that every practice is now multidisciplinary. I mean,
Mm-hmm. Mm-hmm.
it is.
Mm-hmm.
And Peter Dawson, he was asked, in your opinion, what distinguishes the top 5 or 10% dentists from 90% of um, of the rest?
Mm-hmm.
And he said, without any hesitation, that doing a proper, complete initial examination on every single new patient that enters into practice. So, someone with that sort of experience and that sort of importance in dentistry to be so to be so sure that really that is what makes the difference, it really makes you think. And I completely agree with that, because if you don't have an initial examination protocol, you don't have a system in your practice. And of course, usually people, the first question that people ask when we talk about this, okay, but if the patient comes in with pain, do you do a complete initial examination? No. Usually, and this is the basic stuff, is that when someone calls the clinic or emails the clinic, basically they can have two options. They either have a problem or they want an opinion. So if they have a problem, you just go to the decision tree while answering the phone. Okay, let's see what's the problem. Is it a broken tooth? Okay, let's book it to fix it. Is it swelling? Okay, let's book it to do some antibiotics. Okay, do we need some drain? So in the telephone, the receptionist tries to do some sort of trial, to see if how we should book the patient to solve that problem. Sometimes patients want to say, well, I have this issue, I want to do a cleaning. Okay, the patient is booked for a cleaning. But once that is done, he then goes to the initial examination.
Can
So,
I
but when the
interrupt you?
patient calls and says, yeah, of course,
Uh, because you are saying that even if it's not an emergency, so even if it's not pain, even if it's not a broken tooth, even if
yeah,
it's just for a cleaning, so you book it the same for what the patient
mhm,
wants, and then after, so it's not only for
exactly.
pain, because I think these details are important. Okay,
Yeah, yeah, of
sorry
course.
to
Yeah,
interrupt you.
but the patient may have like a wedding or something. He just wants to
Mm-hmm,
do a cleaning. So fix
mm-hmm,
what the patient is
mm-hmm.
complaining about, the
Is
first
asking. Mm-hmm.
appointment. Okay. So also in the cell phone, in the telephone, the other option when the patient says, "Well, I want an opinion," or "Well, I'm thinking about doing veneers," or "I think maybe I will do. I need some. I have a lot of stuff to be done. I'm thinking about doing a crown. I'm thinking about doing an implant." So either the patient wants an opinion or wants something that we know it cannot be done in a day, like a prosto work. The patient is informed, look, here we have an initial examination appointment. It's a 1 hour appointment. That appointment costs this amount of euros. It includes a panoramic x-ray. We will do photographs, and we will do a complete initial examination on you, which takes about 1 hour. And with all the data collected, we will present you a treatment plan that, if it is too simple, we might present you in the same appointment. But if it is more complex, we may need a few days, and we'll have to come for a second appointment for you to present, to present you the treatment plan. And that second appointment is not charged. And on the initial examination, we'll basically want to see exactly what you are looking for, in terms of what you are saying. If you want something more complex or more extensive, we want to make sure that we do a complete examination, and then we'll give you a treatment plan presentation on the second appointment without any compromise. So all these details that I've said in the last minute, they are important. So the person on the phone has huge importance in explaining why this initial examination takes place. So what is the goal? To listen to you, listen to what you want, to go through a detailed examination, to take some photographs, to take some x-rays, and then to present you the treatment plan in the same appointment or in the next appointment. And if so, we will not charge that. And again, it is without any compromise. So all these details are important. And so this is what we try to filter on the
On
phone,
the
and this is
phone.
important because many people have this question, which is, oh, so you do in every patient? No, no, we try to filter those on the phone. So that's how it begins, let's say.
Mm-hmm. Mm-hmm, mm-hmm. And tell me something. For example, let's use that example of that patient that comes with with first time with the broken teeth, and you direct it
Okay.
on the phone to fix the tooth.
Okay.
and then you, on the appointment, you fix the tooth and you present the next appointment to be as the
Yes.
initial
Yeah.
examination,
Yeah.
right?
Yeah.
What about if the
Yeah.
patient says to you, ah, no, 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 I just want to do a cleaning, I don't need no I don't need no
So it's
how do
fine.
you react to that?
So it's
Hmm.
fine. So
Okay,
it
so
is fine.
mm-hmm,
So basically, and we also have, in terms of treatment presentation, we have, let's say, three levels.
mm-hmm,
So the basic level is okay, the patient books because he has a problem or he wants to do a cleaning. And you can see immediately there's a lot of issues there. You see, well, there's gingivitis, there's some cavities, there's this and that. And you can say, well, we need to do a complete examination on you, and you should book an appointment for a complete examination. This is treatment planning. This is also plan presentation. Sorry. So what's the plan? The plan is to do initial examination. So that's the basic level. Number two is okay, the patient is already a patient on your practice and is just doing some maintenance appointments. And during the maintenance appointments, you see a cavity. Okay. And you say, well, we give him a very simple treatment plan written document to say, look, we have to treat this cavity and this is the price, so please book it. But there's nothing new in that patient. The only thing new is that cavity because you know the patient. So the treatment plan, you present it in the same day. And then there's level number three, which is the treatment plan that you present from the comprehensive examination, from the initial appointment, initial examination. So those are the levels. So you can say, okay, I know you came for a problem, but there's lots of issues, so you should book for initial examination. If the patient says no, then it's fine, but at least he was informed
mm-hmm,
of that. Number
mm-hmm,
two is that the patient is an ongoing patient in your practice, and you say, okay, we find a cavity, we should book it. This is the price to deal with that. Okay, that's a simple treatment plan. Nothing else is there because the patient is known. And number three is the comprehensive treatment plan that derives from the initial examination.
mm-hmm, mm-hmm. Okay, another important detail that I think it's very very important for the ones that are listening to us. So on the initial examination appointment, you
Yeah.
don't do any treatment. It's just the initial
No.
examination.
No. No.
Okay,
Exactly.
how much time do
That's
you
the
have for that,
difference.
and how much you charge for that?
Okay, I can be very honest with that. So we charge 40 euros, 40 euros for the initial examination. And if the patient brings an X-ray, like an
Mm-hmm,
orthopontographic X-ray, or
mm-hmm,
50 euros if we do it ourselves.
mm-hmm,
So it's not an expensive price, but you also have to understand that in Portugal there are many people that do initial examinations for free, and we'll
mm-hmm,
also talk about that. I think that
mm-hmm,
something that we should talk about whether we should
mm-hmm,
charge it or not. I
mm-hmm,
think I should charge it because I want that the patients to understand that that is work, even from an
mm-hmm,
ethical perspective.
mm-hmm, mm-hmm.
That's number one. Number two is because if you don't charge, it's human nature that you don't value it.
I don't
The
value.
patient doesn't value it, and you don't value it, and you may not be so
Mm-hmm.
rigorous doing it. That's what I think. I think
That's
human
why I
nature
was
is
asking if you just do the initial examination or if you do a treatment, because of that detail.
exactly,
Because some colleagues,
exactly,
because the
exactly.
practice, it's protocol of the practice to not charge for the
Yes, yeah,
initial examination. They do it in a
yeah,
hurry
yeah.
in an appointment where they do it before or after a treatment, but in order to
Yes,
be able to charge something for that appointment.
I
Otherwise,
understand
because they
completely.
in the practice they don't charge for disappointments, then
I completely understand.
they don't earn it, they don't earn the money, and
Yeah.
that's when you start losing the details, just like you said.
Yes.
So I think it's my
Yes.
opinion that this
Yes.
also should be charged, and it's a very
Yes.
it's a medical act. It's a medical
Yes.
act, so I think it should be
Yes.
charged, and you should be the normal time of an appointment. I mean, to do it in a way that that you don't miss miss the important details, like you were saying.
I think what you just said is critical. It really is the best way to describe this is this way. So first of all, why do people try to do something in that appointment? This is exactly because of what you said. because they want to feel that the patient, they don't want that the patient feels that he's paying for nothing, which is a big mistake, of course. That's number one. Number two is that sometimes with insurances, if you don't do anything, you don't get paid, right? So those are basically, and those are decisions based out of limitations or out of fear. Okay.
Yeah.
So for me to explain you this, let me give you two examples. Let me give you the example of the amateur, and let me give you the example of the professional. So what does the amateur, of course, between commas, because we are all professionals, but what does the amateur do? So the amateur, what it does, the patient comes in, he always does something. But when you do something, you don't have the mental clarity to do a correct diagnosis. Because to do a correct diagnosis demands a checklist, as we will talk about. And if you don't have time, you will misdiagnose a lot of things that you will regret further on. You will misdiagnose a lot of things. Because trust me, if you do an initial examination, a proper initial examination, you will see that all of a sudden, the amount of dentistry that your patient needs, sometimes not invasive, but they need a lot of stuff. They are bruxers, they have tooth wear, they have recessions, they have alignment problems. I mean, there's so many things that can usually be improved, and sometimes they are not even expensive, but there's so many things, even prevention, there are so many things that you can do. So there's that issue, it is that if you do something, you will not have the mental clarity or the mental space or even the time to be able to do a correct diagnosis. And what the amateur does, it tends to subdiagnose, right? And it tends not to see details that he will probably regret once he starts the treatment. And the amateur, basically, it talks too early. It talks about money and treatment options too early because he also has that notion that patients want to know everything in the same appointment, right? So the amateur does those issues, which is, yes, he does treatments, he does something in that appointment, and he misdiagnoses a lot of things. And once he misdiagnoses, he will start to regret it. Okay. Now the pro is a completely different story. The pro understands or has been through a lot of pain in the past, and he understands that he does not have the mental clarity or the time to be able to do a proper initial examination. And then he realizes, well, I cannot be a hostage of the money. So he realizes one thing which is important. It is more important than charging it or not is that I should do it. So more important than charging the initial examination or not is doing it, having a consultation where he does anything else but the initial examination. Now, whether we should charge it or not, I agree with you, it's a medical procedure and I think you should charge that. But sometimes in some practice, because of insurances, sometimes they do free initial examinations. I think that is a mistake. You can eventually charge an X-ray or you can do something to justify, let's say, the price, but I think you should charge it, okay? And I charge it because I think it's ethical to charge, and I think human nature does not work well with free, with when you don't charge, nor the patient nor you. So the pro understands that in a sense, well, I have to set the time to do that. And once he understands that, then he starts to think about how he should implement it. What we have just talked about in the first question, which is how does the patient approach the practice and how does the practice sets the patient to go to a treatment or sets the patient to go to initial examination. All those are derived from the decision that we have made to do initial examination. So once you make that decision, you have to create a system for it to work. And the patient approach to the practice and how the practice guides the patient workflow and how the receptionist informs the patient, that is also critical, right? So once you have that decision, okay, I'm going to the initial examination, then all the system, then there's a lot of questions, which is, okay, who is going to do that? How are we going to screen the patients on the phone? Once we do it, when are we going to present it? How do we talk between all of us? So all those questions now they come to your mind and you need to deal with them, right? But I think that the main issue is to decide that you should do an initial examination.
Mhm. Yeah, yeah. I was taking notes of what you were saying. I like several things. Hostage of the money. I think dentists are some are
We all are, yeah.
yeah, we all are, but dentistry is a trap. If you are don't if you are not self-aware of that, you
Yeah,
really become hostage of the money. And yeah, the situation of initial examination is an example, is a perfect example of that.
yeah,
um, and it's interesting because you think that you are losing money because you do an initial examination that sometimes it's
yes,
or losing time even, and then it's what actually brings you money. um, uh,
exactly.
it's so it's seeing it's not seeing things as
Yeah,
in the long term, is having a very narrow vision. But again, it's based on fear. You mentioned that also. And another thing that you said very important is that it's more important than charging it or not is doing it. So that's a really good one also. Um, and I think that we touched the reasons why some dentists don't do it. You think it's some dentists or it's the majority, or do you think that things are changing? Do you think that initial
I think,
examination it's something that the
things are
majority of
changing.
dentists practice?
Yeah, I think that things are changing. I just want to go. I think that I said something in one of the previous podcasts, which is it's not only doing dentistry that makes money, of course, in an ethical way. It's diagnosing and thinking about the dentistry that you should do to that patient.
Hmm.
So it's not the dentistry itself, it's just the diagnosing and the thinking about what's the dentistry that you should do. Because if you don't have time for that, if you don't have time to set what you are going to do, you will always end up doing something that is either wrong or less than it should be.
Hmm.
Okay.
Hmm. Yeah.
Yes, but you were asking how many dentists do I think? Well,
No,
I
no.
think
Do you
that
think if it's by your experience
yeah,
with not only with the colleagues' feedback but also
yeah,
your teaching
yeah,
experience, if you
yeah,
think that dentists, I think that if you ask every dentist, of course, there's no one that does not recognize the importance of the
yeah.
initial
But to do
examination.
it, yeah, if they
But
do
one
it,
thing
yeah,
is to recognize it, and another thing is to do it. So, do you think
yeah,
it's the majority of dentists actually
yeah.
do an initial examination? I mean, in a way that allows them
Mm,
to really
no,
be aware of the details and allows them to then to do a good treatment plan and diagnose for their patients.
no, I don't think so. I think that it's a minority. It's a minority. I would say it's about 10%, like Peter Dawson says. I
Hmm.
would say it's 5 to 10% people, the dentists that actually do it. And the reason that they don't do it is because of what I was thinking is about one thing is deciding or having the idea. The other thing is execution. Execution is difficult of initial examination within a team because you have to think, you have to have a well-trained um, phone assistant, very well trained to guide the patient. Um, and then you have to have a team that is able to perform that. And one of the reasons, basically what happens is that some people they try to implement it, but then there's this thing which is the rock star always wants to do the initial examinations, the rock star of the practice. There's this, like the main dentist, usually the dentist that gives name to the practice, which is also, I think it's a mistake, but still, they believe that the thing is okay, I'm only going to do the initial examination and then I'm going to delegate the treatments to some other colleagues. And it might work, but it still means that the critical part of your business is non-delegatable, which is extremely dangerous, which means that If your practice is based on the rock star of the practice doing initial examinations and treatment planning, you are in a very bad situation if something happens in the future. You are in a bad situation if you go on vacation because it means that new patients cannot come in the practice. So one of the things that I learned, and I learned this with Gallup Gurel many years ago, more about 15 years ago, is that it should not be the rock star that does the initial examination. It should not be the rock star.
Mm.
So the person that does the initial examination should be one of your delegates, one of your associates. So in my practice, we have Teresa and Luis that do most of the initial examinations. They do initial examination, then Teresa does the prosto, and Luis does more of the surgery. But they both do the initial examinations, and we try to distribute them equitatively to them as the patients as they come up, and they both know how to do initial examinations. So but then the biggest fear is, okay, how can I trust my associate to do such an important thing, which is the initial examination, which is what will bring me the first, it's the first contact with the patient. So we want to have something that is nice, that can establish rapport. That's number one. Number two, will they be able to diagnose? Will they be able to talk about money? So all these questions, they create a lot of fear in the practice owner, in the rock star of the practice. And
And that's why they have difficulties in delegating that, because they want to control.
Exactly. So the thing is, it all comes down to the question that we've been talking so much in this podcast, which is you have to have a team. It cannot be all on you. And if you don't trust that your team can handle sensitive situations, such as first patient contact, talking about money, good diagnosis, good establishing of rapport, being pleasant, being trying to create a connection with the patient, an honest connection. If you think they can't do that, then you have to rethink your practice. You have to rethink what you're doing, because if you think that you are the only one that can do that, then yes, you have a rock star problem, and it can work in a very small practice, but it will take its toll on you. So yes, all these small details that we talked so far, how do we establish rapport, how do we make good diagnosis, how do you present a treatment plan? And by the way, they don't have to present in the same day. If they have doubts, they can always present it on the second one. So you have to take some risks, and of course you have to train them. You have to have systems, written systems, regular meetings. But you, at the end of the day, you have to let go the control and let them work their way with proper guidance, of course, with proper meetings, and to make sure that everything has the same culture, everyone is on the same path. All the things that we talked so far, the systems, the culture, the meetings, to make sure that they are on the same path to as you, so that they can have some good chances of making a positive impact with the patient. They may not be as perfect as you in the initial, but that's just like everything. If sometimes they will make mistakes, but you have to be there to support them, just like everything. So if you want to make a team, you have to be able to you have to be able to let the control to them, and to coach them in so many different ways to do that.
Yeah, and the thing is that no one is irreplaceable, even if we think at some point that we are not. So
Exactly.
it's better to be
Absolutely.
prepared. Better
We
to be
are we
prepared.
are not replaceable in any aspect of life.
Yeah. But the thing is that delegation that you did. So it's, if imagine that you reach the conclusion that you need someone else to start doing the initial examination. So the way that you
Okay.
have that in your practice, so you have a system in place, so that
Hmm.
means that you can train another colleague to start
Of
doing
course.
that, right? So
Of
it has
course.
a system, so it is based on
Of
a
course.
checklist, like you
Yes.
already said. So it means that you made it simple in a
Yeah.
way that that it's possible for you to train someone, for you to coach that
Very
someone, for you
easily.
to
Yeah.
correct the mistakes that are
Yeah.
perfectly normal in the
Yeah.
beginning. But after that, that person will be prepared to in that
Yes.
same level to do
Yes.
the initial examination, just like you and the
Exactly.
colleagues that now are performing it in your practice.
Exactly. It's all about small details. How do you talk to a patient? What questions do you have? So, what if you gather all the details that you use to establish rapport and record a good diagnosis? What if you could gather all those details, put them on a paper in a simplified way that anyone that could look at that paper would do very similar, would
Hmm.
do something
Hmm.
very similar? So what we do is, well, the patient arrives, he has the medical history, and the patient arrives, and the dentist greets, and um, he basically explains what they are going to. We are going to do the initial examination. This is written down. I can see from your medical history that you have this, this, and this, and that the medical history is the first contact with the patient to establish some report. So it's not accidental that you start to talk about medical issues. Okay, so you're a smoker or you have this disease. Or, so it shows genuine care. Genuinely, of course, it's not a very positive subject because we are talking about whether the patient is a smoker or he has some health issues or this or that, or he takes some medication. So we try to make it not very negative, but just try to make a connection with the patient because it's always a sensitive question. Okay, so now they are going to start digital examination. We tell them, look, we are going to start this examination. We are going to recline you, and me and the assistant, we are going to talk between each other and ask you some questions. Okay, is that okay? Okay, so they start. So the first question is, okay, so what's your main concern? What brings you here? And we write down. Actually, that question is done when the patient is upright. And then we start an examination that goes from the outside to the inside. We do ganglionar palpation. The doctor places gloves, and it's written down. So doctor places gloves, assistants asks this, and doctor. So we have this protocol for ganglion palpation. Number one. Then we start to look at start to do some palpations on the TMGs and on the muscles. We start to ask if they have some pain, and then we start to see the occlusion. We start to see if the guidances. We start to see the molar class 1, class 2, class 3, and then we start to see like centriculation and stuff like that. So we go from the macro to the micro. So some interesting things that we do that make a very positive impact on the patient. So in the oral medicine section, we use a gauze that the assistant says, well, oral medicine, and the doctor opens the mouth. And actually, by the way, when there's a transition from using the gloves outside to the inside of the mouth, there's a sign in the initial examination that says, well, we should change the gloves. So basically, the assistant is already ready with some new pair of gloves whenever we try to avoid cross infection. So we go and we see all the mucosa. Then we ask some questions regarding lifestyle in terms of sleep apnea. We see if they have any, and we try to do some screening because it's a very important issue. It's a very prevalent. We ask them how the patient sleeps, if they grinds their teeth, if he snores. We also ask if the patient something. We also ask the patient has had measured their blood pressure over the last year. If they have not, we do it ourselves. So there's this sequence that we start to do. We reach the oral medicine. We also, regarding the hygiene, we ask how many times do you brush your teeth a day? Do you use a regular toothbrush? Do you use a normal electric toothbrush? Do you use floss? And this is just like 1/4 of the initial examination. Then we will go through a lot of things. But you can see that it is done in a way that any associate will make a strong impact in the patient, because what you'll ask is this: in the patient's head, this is what's going on. I have never been examined like this. I've never been examined like this. And that's something really important, because like one quarter in the first quarter of the initial examination, you have already gained the patient, I would say, because you are genuinely looking for something that they are not used to, which is to see the whole patient and not only teeth. And of course, that we have some, for example, if the patient has a TMD problem, or if the patient comes specifically for a TMD problem, we have a subsection that we fill, or if the patient has a periodontal problem, we have a subsection that we fill. So we go through that. And then we also have some funny questions, which are always interesting, which is, okay, how much sugar, how much candy do you eat a day? And then we start to think that it is done in a way, and the sentences, they have been written in a way that create, I would say, a safe environment, a positive environment, but also funny in some ways, because people, they are always amused when we talk about also, so do you exercise, or how much hours do you sleep? They always have this comment to make a report, or how much candy do you eat? So these normal questions, they always elicit in the patient, most of the patient, a very positive response, and you can start establishing rapport. So you see, the initial examination is not only to gather diagnosis, it's also done in a light way, so that rapport is easy to be done.
To build and to build trust. Let me ask you two questions
Trust.
that I wrote here while I was hearing you talking. Do you think that? Do you think, no? What you are saying is that the initial examination is actually a differential thing in your
Of course.
practice, right?
Of course.
And
Yes.
do you feel from your experience that patients already go to your practice because they already know
Yes, for sure.
the workflow and the
Yeah.
attention that they are going to have?
Yeah. I from the inquiries that we do to our patients, and we haven't done none this year, but most of them, they have been referred by other patients. And I don't know what exactly other patients talk about us, but I would feel that is a critical issue. I would say that's a critical issue, because even with this method, of course, you will eventually get more treatments, and your treatment plans will be higher in price, because you will just spot more stuff. And also because that's the nature of our practice, we are interdisciplinary. We like to do complex stuff, basically. So prices may be, and treatment plans may be usually higher than the average, I would say, the average practice. But even if you can afford, even if you can't afford it, if someone asks you, okay, do you know a good dentist? Oh, so who's the best, or who are some of the best dentists around this area? I think our name would certainly come between on I wouldn't say the top, but at the top 3 or 4 or 5 or whatever, but certainly at the top. And I am 100% sure that that the initial examination has a major role there.
Okay. And when you teach, how do you teach your students to perform this? Here I'm not talking in a system wise, because you already explained that you have the checklist, and I'm sure that I know that you give that checklist. You also give it in our leadership course to the participants. But I'm not talking about that checklist. I'm talking about for someone that doesn't own a practice, and that the practice does not have implemented this system of initial examination. How do you say to your students, because you are I know that you feel very strong about the importance of the initial examination, and the power that the initial examination has for you as a dentist, and also to determine the kind of work that you want to do. So
Yeah.
I'm sure in the courses that you give, you
Yeah. Some
you you
hints.
str-
Yeah.
yeah, it's you insist on this part. So
Yeah.
for someone that does not own a practice, how
Hmm.
does that someone start to do the initial examination on their dentistry life? And if the
Yeah.
practice
That's a
does not
yeah, a
contemplate,
protocol. Yeah.
the time for this.
Yeah. Well, I think that first of all, you have to be convinced as a dentist, even if you don't own the practice, you have to be convinced of the importance of the initial examination.
Hmm.
So, all this talk that we have so far since the beginning of this episode, we go through on the presentation. We understand this is this, and usually they get very convinced and very enthusiastic about it. So, now the question is okay, but in my practice, they don't do that. We do treatment
Hmm.
plans in between appointments. So, my recommendation to those is um, try to see and try to talk to the person in charge to see if they can accept this kind of proposal. So you go to them and you say, well, I've just been to a course and I understand initial examinations are very important. And I have a proposal for you. For 6 months, let me do initial examinations for 1 hour. I don't want to earn anything. If you want to charge it, you can charge it. But for me, earning it, it's not the decisive factor. I just want to make sure that you can allow me for 6 months or 1 year to perform initial examinations on patients. Do some sort of reception screening and just make, I just want to do that. And if it's easier for you, just make it for free. And let me do that. And if after 6 months or 1 year, you are not convinced that this protocol will be more profitable to the clinic in terms of selling treatment, then we can stop it. But if you think it's positive, then we can maintain it and we make it a rule from the practice. So I think that most dentists, owners of practice, wouldn't find this a good deal. Okay, and of course, that if you are working some sort of network of practice or um, corporate or some sort of franchising. I know it's more difficult, but just try to speak with someone in charge to let you do that. And if you do it for free, I mean, they have nothing to lose, because like I like usually say in life, you have to, your success in life. This is a quote that I learned from Alok. Your success in life starts at the work that you do um, above what you are paid
Hmm.
for.
Hmm. Hmm.
So if you only do what is fair for what you're paid for, you'll always be in the status quo. So if you bring more value, which is if you bring to your bosses of the practice something more than you are receiving, then you are bringing extra value. Then you are doing more than what you're paid for, and that's where success and that's where good things happen. To go beyond um, what is expected,
Hmm.
to go beyond what is fair, to be beyond what is usual. So
Hmm.
if you do that, if you are willing to work or to do initial examinations, and they are fun, if you, I think that initial examinations are a very important skill to practice, because you will learn a lot. You will develop your occlusal diagnosis, your oral medicine, your sleep apnea, your occlusion, your aesthetics, because there's a checklist that will basically force you to go through everything, and you will become a better dentist. So you are not losing by not charging it. You are always winning. And I think this is a good proposition that you can eventually do to the person in charge of your price. And it will work, trust me. It will
Hmm.
work,
Hmm.
because you will distinguish yourself within the practice for
Hmm.
sure. I am
Hmm.
100% sure about that.
Yeah, I totally agree. It can be a very positive differential in your career, and it's interesting because I don't know if you have this feedback sometimes when you talk to colleagues, but I sometimes talk to colleagues that say that they, that feeling that they are filling holes all day long. That's their job, and I feel that that's the kind of dentistry that you only treat teeth, and the initial examination gives you the feeling that you are treating people. You see the patient as a whole. You cannot see the patient as a whole if you only treat teeth. Do you understand what I'm saying? I don't know if I'm making
I
sense
completely
here,
agree with that. I completely agree.
but
You are making complete sense.
but
Complete
but
sense.
it's one of the
And it
questions that I make to these colleagues when they say that they have this feeling that they are just filling holes all day long,
yeah,
is if
yeah.
they practice this initial examination. How do they
And
start
if
their appointment, their interaction with their
with a
patients?
patient. Exactly,
Mm-hmm.
exactly. So you see, once you start to talk about initial examination, you see that its implications, the implications of doing it, of good implementation of practice, go way, way beyond
Mm-hmm.
diagnosis,
Mm-hmm.
way
Mm-hmm.
beyond.
Mm-hmm.
They
Mm-hmm.
deeply impact the quality of the dentistry that you do, and
Yeah.
it deeply impacts your fulfilling in dentistry. I have no doubt
Mm-hmm.
about that. This
Mm-hmm.
is why I'm such a fan of implementing this. I'm really,
Mm-hmm.
really a fan of this. And you don't have to be an elite dental practice. Any sort of dental practice can implement this. It may be a simple examination, it may be a more complex examination, but you should think about that. You should think about so what do I want my associates to bring to the patient when they are doing this examination? What is the the feeling? What is the culture that we want to pass on to the and every clinic is different, but you will cause a huge impact, a huge emotional impact on the patient.
Mm-hmm.
In my opinion, this impact is even higher than when you do like DSDs or emotional dentistry regarding DSDs and mock-ups and stuff like that, that you can see the patient before and after, which
Mm-hmm.
has a huge impact, of course. But I think this impact is you hit the trust button
Mm-hmm.
basically with the
Mm-hmm.
patient.
Mm-hmm. Mm-hmm.
And I was recently talking to a colleague of mine, and he was saying, "Well, um, there will be always be," and he was talking to me to say, "Well, I think that yes, the way that you talk it resonates with me, but I don't. I sometimes think that you forget that there's many different types of patients." And he was telling me, "Look, there are some patients that whatever you do, no matter how you treat them, they will always everything will be fine. They are okay." Some other patients, they want to be treated like they are superstars, like with fireworks. Okay, let's say with
They
a
want to
lot of
feel
emotional
special.
dentistry.
Yeah.
They want to. They like to go to an amazing waiting room. They
Mm-hmm.
want to have like cutting edge architecture inside your practice to take photos for Instagram. They want to feel, and it is important because I think that the look of your waiting room and of your practice is a reflection of what you want, and it's important to feel comfortable there. And says, well, there are some other patients they just want to be sold. They don't want to talk. They don't want to know about money. They want to be at the dentist as they are in the hairdresser or buying shoes. Some people are like that. And I said, well, it's true, but yes, it's true, but sometimes, but maybe my problem, I was talking myself, maybe my problem is that I attract the kind of patients that are more similar to me. And he says, well, that's correct. And it's true. We do tend to attract that kind of patients that are
Mm-hmm.
more similar to,
Mm-hmm.
to, to, to myself. But having said that, I think there's a huge trend towards transparency and non forceful selling. There's a huge trend towards information rather than pressuring to sell. And I think the amount of patients that really look for trust and look for transparency is rising because if you don't, you just have to look at the evolution of digital technology. Why has Uber been so successful? Because there's transparency. Because you know what you're going to pay. You know that they're not being arrogant. You know what you're into. I mean, so many so many businesses have thrived based on transparency, of bringing more ethics, more ethical and more transparency values to the table. So this is why I also think that even private practice, they should see this. Yes, I understand that some patients, they want to be sold treatment like you are in buying coats or you are in Louis Vuitton or wherever, and it's true. But I don't think that's the vast majority. I think the vast majority wants thinks for their own head and wants the best for their own health in a transparent and honest way. That's what I think. So I think that's the huge chunk of patients, and I think that you should target those. That's what I think.
Yeah. Yeah, yeah,
There's nothing wrong with
I
being an
agree.
elitistic practice and going for a small niche. There's nothing wrong with that. But I think that you will be safer if you go for the, I would say, the average patient. Yeah.
Yeah, and one very interesting thing that you said also about your initial examination, when you said that there's this interaction with the patient, and that also it's a lot of fun. I really liked it because not only you said it in a way that it can be fun for the professional. So if you bring
Yeah.
your curiosity, if you know what you are doing, if you like what you are doing, it can actually be a fun appointment. And also for the possibility when to be done in a way that the patient has the opportunity to intervene. Okay, so it has the opportunity
Yes.
to answer questions and to say his
Yes.
point of view, to share his
Yes.
opinion,
Yes.
and to feel that, okay, this is an appointment where he's hearing what I say. So I think
Yeah.
that's also very important to build connection, to build trust, and from that moment on, when that relationship is
When
established.
you break the ice.
Yeah, that's it. And from that moment on, then even your work as a dentist will, I mean, not only, of course, for the patient to accept the treatment plan, but even for you to work, because we know that patients, when they are with their mouth open, sometimes they are very tense. But there are studies that say that if the patient trusts you, then immediately he's more relaxed and he lets you work more easily. So that's important
That's yeah.
for that
Yeah.
connection also.
Yeah, that's something that I haven't thought of, but it's completely true. So as you see, the more you dig into, the more advantages it has to the initial examination. Just have to decide, and then don't lose hope when you find difficulties, because as we were saying, you have to train your receptionist and you have to train your associates to do that. You have to train them to do that.
Hmm.
So it's
and and also I think that a good way for colleagues to look at it, because I think that sometimes they still think it's like it's not a waste of time, but it's time that they are not
yes,
going to do any treatment, like we were
yeah,
talking. It's not going to be paid. But so instead of looking at it like from that point of view, to start bringing this other perspective that we brought here today, so that it's actually not a waste of your time. It's going to be a positive differential in your dentistry practice. It's going to actually makes you save time
yes,
in the future, because you will not miss the important details that will make the difference on your treatment plan, that will avoid you for sure frustration in
yeah,
the future. Also, it will build the necessary trust and connection
yeah,
with your patient, that
yeah,
will make it much more easier for you to influence your patient in a more positive way. You will not feel that you are selling treatment plans. You will feel that you are presenting the best solution to help that person. And
yes,
also it brings also the human connection. It brings the fun part to the dentistry. And it's very interesting, Andrea, because I was talking to a colleague last week, and she's actually not
Hmm.
working in the dentistry for that many years. I mean, I think, if I'm not mistaken, 5-6 years, and she
Hmm.
was already accusing a great level of stress and deception with the job.
Yeah.
And one of the interesting things that she said was that she first major in another thing, health related, but then
Hmm.
she went and do dentistry because of the
Yeah.
opportunity that she had to build a relationship with patients. And
Yes.
now, after 5 or 6 years with being a dentist, she says that patients are her main source of stress.
Yeah.
And I think that it has a lot to do with this that we were talking about, because dentists at a certain moment, they lose this ability. In the beginning, we are very aware of the details, and we are very aware of building this trust connection with the patients. We know that it's important to listen to the patients, to listen to the details, to do the initial examination. But then it's like, after just a few years, then you just start treating teeth, and you forget about the importance of
Yeah.
this. I mean, it's not that you forget about the importance, you know the importance, but you stop practicing it. And and I think that the initial
And also,
examination also has this power, the power of you continuing to treat people,
yeah.
you continuing to have this relationship. It's an with people, it's an opportunity for you to talk, it's an opportunity for you to listen. And it makes all the difference. It's an opportunity of for also for you to choose your patients, you know,
Of
to
course,
see the red
to
flags, because some patients are not for
yes,
you, and you may say, okay,
yes,
maybe uh, Andrea or João or Rita or whatever can help you better than me. You don't have
yeah,
to say it to the
yeah,
patient, but you can already organize it in that way, you know, because
yeah,
we don't have to see everyone. That's an important thing
yeah,
also. And the initial examination gives you the opportunity for also for this. And this, I think this is very, very important for colleagues also to not forget. And in the beginning we do it, but then something happens that
yeah,
we lost it along the way, we lose it along the way.
yeah. We tend to. I think that the main reason is that if you don't have a good screening on the phone, all the patients want to book for treatment. So
Mm-hmm,
if you have a good
mm-hmm,
screening on the phone, they will eventually understand that. But if you don't have, they will eventually want to do something. So that you have to explain them.
mm-hmm, mm-hmm,
Also, something that we do is we classify at the end of the initial examination. We classify the patient in terms of communication,
mm-hmm,
conflictuality,
mm-hmm, mm-hmm, mm-hmm,
and then risk, periodontal, functional,
mm-hmm,
structural risk, but then also emotional risk. Is
mm-hmm.
the communication easy? Does the patient understand what we are saying? Is the patient very picky? Is the
It's very
patient
important
having,
because, yeah,
yeah,
people are not all the same, so
yeah,
why do you treat them all the same?
yeah, yeah. So a couple more things, which is like I think that talked that I never do initial examination. It's always them that do them. And if
Mm-hmm,
the patient calls and says, "Look, I want the initial examination to be done by George André,"
mm-hmm,
then the receptionist says, "Well, first we have to do a trial. You will be seen by him on the presentation, but in the first trial appointment, we have to gather some data so that so that they can all meet and make a meeting and then present you the treatment plan." So, but then when I go to the second appointment, if really they want me really to be there, I know what the patient wants. I know all these answers. And also, this has to do with something that I will also like to say, that don't feel the pressure to give the treatment plan in that appointment. That's a
mm-hmm,
huge mistake.
mm-hmm,
That's a
mm-hmm.
huge mistake.
So if
If
it's
you're not
what do
confident,
you do?
if
If it's simple, you do it in the same
yeah,
appointment.
very
If it's
simple, the same
mm-hmm,
appointment. If it's more complex, if it will involve, because one of the answers, one of the questions that we ask in the initial examination is, um, if the teeth are misaligned, well, what do you think about orthodontic treatment, either with brackets or with aligners? That's one of the questions. Another question is that we go through, there's this chart that we use, for example, for missing teeth. So something like this. So there's a tooth missing. Does the patient have a denture? Yes. So if the patient has a denture, the question is, are you happy with that denture, with that removable denture? No, I'm not happy. I want something fixed. Okay, so would you like for me to give you some options? And says, well, yes. And it's really very simple. So in the initial examination, for example, Teresa or Luis, if they see if there's a missing tooth, they look at the adjacent teeth and see, well, is it possible to do a bridge? Yes or no? Or is it just an implant? And they say average prices. When they look at the tooth, the mouth, they say an average price of what they think, or if it needs ortho, if it needs implants, if it needs that. So if there are two teeth missing adjacent, like two implants, if there are three teeth missing on the mandibles, like maybe two implants and three teeth. So there's just very simple rules, but the goal here is, if the patient wants to talk about money, says, well, how much is it going to be? So we can give him an idea, an approximate idea, and we say, well, we are talking something for fixed around 6,000, around 10,000 euros. But this is just a rough idea. Would you like us to present a very detailed treatment plan on the next appointment? And as you know, we will not charge for that. And he says, well, it makes no sense for me, so that's too much. So it's out of question, which is fine. We are not wasting the patient money. But if the patient says, well, yes, I'm interested, then we book for the second appointment and we present a treatment plan. So it's not that we go for the second appointment completely blind. What I do not want to happen is that I go to the second appointment with a 20,000 euro treatment plan and the patient earns the minimum wage. Mm-hmm. So we have to see, the patient has to have a rough idea of what we are talking about, a rough idea. And that brings me to the final mindset, which is really critical, which is, so there's no pressure to tell the final treatment plan, detailed treatment plan on the first appointment, and there is never pressure to sell anything, never. Mm-hmm. And the patient must feel that since day one. The patient must feel that in the phone we told them, look, there's no compromise in coming to the second appointment, to treatment plan presentation. And even the doctors, when they present the treatment plan, the biggest mistake is to be focused on the outcome, which is if the patient accepts it or not. That's the biggest mistake. What you have to do is you have to focus on the process of explaining. And we are very straightforward with the patient. Sometimes we even tell them, look, and of course we are already talking about treatment presentation, but it's all connected. We tell them, look, what we are here doing is an information. We are providing with information. Either you do it with us, either you don't do it. If you do it with someone else, that's not what matters at this point. What matters is that you are informed and that you go home and you make your own decisions. And even if you want, you could ask some second opinions. So we are honestly and actively telling the patient that this is information only. And this is our interest. You are paying for initial examination. We are providing you information. You can take your time. You have your exams. They are yours. You can ask for second opinions, and then you decide. So I think this is really, really a fundamental mindset that needs to be on the back of your head whenever you are doing either the initial examination or the treatment plan presentation.
It makes all the difference.
I think so, yeah.
Yeah, let go of the outcome. Tell me something. I don't know if you said that you inform your patients that there are no obligation to come for the next appointment of the treatment plan presentation, if I understood it right?
No, we tell, basically what we it depends. If the treatment plan is very easy, we give them straightforward in a very simple document. But if there's a lot of treatment, we will always want to, let's say, what we call qualify the lead, right? In the marketing, we want to qualify them. And we tell them, look, this amount of dentists, we are talking roughly in between 10 to 15,000 euros.
Mhm.
That's roughly. But we
Mhm.
would like to give you a detailed treatment plan about that on the second
Mhm.
appointment with exactly what we are talking about. How do you feel about that?
Mhm.
What do you
Mhm.
think? And he says, well, that's completely out of question.
Okay,
Just do me a
that's how you do the
presentation of
screening.
some.
Okay. Mhm. Mhm.
Yes, yes,
Mhm. Mhm.
yes.
Mhm.
Because some patients, it's just complete
Yeah, of
nonsense to
course.
them to spend so
Of
much
course.
money.
Mhm. Mhm.
And for others, it is nonsense, but they want to come and see.
Yeah, that's how what
So
I was trying to get clear. How you
yeah,
do the screening, how you make sure
yeah,
that that patient that has a treatment plan of 20,000 euros doesn't arrive and say, "What are
yes,
you doing?"
yes, yes.
That's
What are you
because that's
talking
very
about?
yeah,
You
that's
should,
very important.
yes. What are you talking about? You should have told me. I earn
Mm-hmm.
600 euros a month. It's
Mm-hmm.
not possible.
Mm-hmm.
So we want
Mm-hmm.
to qualify them for that.
Mm-hmm.
We don't
Mm-hmm.
want that to happen. So we give them
Mm-hmm.
approximate prices on the first, and it's not difficult. It's actually very easy. Just how many teeth are missing? Is there wear? Do you need to do a full mouth? Can it be composites? Can it be ceramics? Is it full mouth implants? Roughly, you are talking roughly, just to
Mm-hmm.
qualify the patient. Then it may
Mm-hmm.
eventually, the treatment plan end up being 5,000 more, 10,000 more. It depends. But there's always options that we give to the patient. Sometimes we can do it with ortho or without ortho. Sometimes we could give it with ceramics or without or with composites. But we want to make sure that the patient is aware that it's going to be a lot of money in some
Mm-hmm.
situations. Yeah.
Mm-hmm. Mm-hmm. Okay, and last, I don't
Before
know
going
if
to
you
the
are
second appointment.
comfortable sharing this, but what is the acceptance rate? High? No, you don't have to.
um,
High or
no, 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 no. We have an acceptance rate. We had an acceptance rate from before the pandemic. I think it was in 2019. Our acceptance rate was above 50%,
mm-hmm.
above more, actually
Mm-hmm.
more than 60%. Yes.
Mm-hmm. Mm-hmm.
Yeah.
Mm-hmm. But
And we
with
are
that
talking,
mindset,
no,
yeah.
but we are
Sorry.
talking about complex treatment plans. Sorry, we are
Mm-hmm.
talking
Yeah.
about
Mm-hmm.
the
Mm-hmm.
other ones that the acceptance is higher, but treatment plans above 5,000,
Uh-huh.
where we
Uh-huh.
use Make Me Clear, the acceptance rate was
Uh-huh.
about 60%, which
And
is even if it's above 20% is very good.
yeah, no, yeah, it's
Yeah.
very good. But with that mindset of let go of the outcome of the expectation, so you are there to inform. It makes things easier. No, don't it?
Yes, yes, exactly. It's reverse psychology in a way, but that's a different story. But it also, what it also does, it relieves the pressure of the people working.
Yeah.
Um,
Hmm.
it's. I mean, you feel more human. You feel more like a professional. You feel less like as a seller. I think your mindset is more adequate. You
Hmm.
are
Hmm.
calmer working because you're not selling anything
Hmm.
basically. But
Hmm.
by the way, so for example, Teresa does proston, Luis does surgery, implants and perio. When Teresa does a treatment plan and in the treatment, if it includes surgery, she gets 2% of the price of the surgery. And Luis, she gets 2% of the price of the prosto. So they always win, even if they sell something that is not them that is going to do it.
Hmm.
They
Hmm.
always win. Yeah.
Hmm. 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 Yeah. Okay, thank you. I don't know if you want to share anything
No, I
else.
think we covered. Yeah, I think we
Yeah,
covered pretty much
the basics. Thank you for
the
being
basics and the
so
details. I
honest
think we
and
went.
for I thank you for being so honest and open about your experience, and then for sharing your I
I
mean
think
it's
it's.
your personal experience and
I don't think that today you can really. First, you can't hide anything. Number one, and second, you don't win anything by hiding
by
anything.
hiding it.
I
Hmm.
mean,
Hmm.
it's just
And
information is all
you are
out
very
there.
generous in sharing knowledge and in sharing your and the way that you use your information. You are very generous in doing that. So I see it
I think,
in the
yeah,
course, and I see
yeah.
the way that you speak from your heart. It's really in a generous way. So thank you.
I
It's
think
really.
that the reason why I do this is because I gain much more than what I give. That's number one, and
Mm-hmm,
also because I'm in a position that I don't see. I think I've practiced dentistry enough and lived enough to understand that uh, the world is an abundant place, and there's always a place for
mm-hmm,
you. And I truly mean this. Uh,
mm-hmm,
I don't think that you get to this mindset without a lot of work and a lot of pain and a lot of headache and heartache with the profession. But I think that there's a lot of abundance there,
mm-hmm,
and I usually try to pay forward what some people have done with me, like Alok and some other people, and I read a lot about ways of implementing because I started by teaching technical dentistry, but I soon realized that that's not enough, as we've been talking about, and you
mm-hmm,
have to have some other tools, some emotional communication,
mm-hmm,
spiritual tools, let's say, mindset tools, awareness
mm-hmm,
tools, mindfulness tools. I mean, it's you really have to have them, and I think that sharing and giving is an essential part of that.
mm-hmm, mm-hmm. Yeah, thank you so much. We were talking, and I just came up maybe with another subject for another podcast episode about because I think it has a lot of to do with also what you coach your dentists for the initial examinations. And I even had written here a question to make you, and I didn't make it, but maybe for another episode. If you coach your colleagues for non-reactive behavior when they are talking to patients, and
I
I know
knew
this
that
is.
I knew that
I,
was coming. I
and I
knew
know
that was
this is
coming.
something. Let's not talk about it now because it's already 1 hour and 15.
It's cool.
Let's
It's
just
nice, but
do.
but
Let's do an episode
let me
about
ask you
that.
something. Let me ask you something. And because I always feel a little bit awkward, and we will leave this to some other time. I always feel a little bit awkward when I think about that because I think that when I talk about this, sometimes people have the idea that I am this manipulative uh, 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 like like that does a lot of psychological games with patients and with people, and it's not true. It's not true, but
No, I think
it
I
is
think that you
important
are
that you
teaching
are.
self-awareness. I think that you are teaching
Yeah.
self-awareness, just the same way that we were talking about in the of the importance of the initial examination and of building trust with the patient by allowing the patient to talk. Of course, then you have
Yes.
to have some abilities
Tools.
of
Some
emotional
tools.
intelligence, which is based in self awareness, to not react. Otherwise, what will happen is that if you are not aware of it, then you get reactive, and then you are not in
Yeah.
control, and then you
Yeah.
and you recognize not only you recognize the
Yeah.
importance of that, and I'm
Yeah.
sure that you learned it based on
Yeah.
your own experience, and
Yes.
probably you had some experiences, and you start, okay, what's, and of course you also read a lot, and you also search a lot, and you are interested in
Yeah.
this subject. But I think this is very important in dentistry, and maybe some of the reactions that you have when you talk about this, it's because
Yeah. Also
dentists are
because
still not
yes.
used to talk about the emotional part.
Yeah.
They are only
Yes.
used to talk about the technical part.
Yes,
And
but the reason that, sorry, the reason that I'm asking you is
mhm,
because sometimes I use some not very orthodox or a little bit out of the box examples regarding sexual energy and
mhm,
masculine and feminine and stuff like
mhm,
that. But the
mhm,
reason why I do that and I give all these examples is because it really touches the
mhm,
button of
mhm,
each one, and they
mhm,
can really understand the powerful
mhm,
of using some of those techniques because when you give some examples, they all of a sudden are like, well, this is just not okay. I should not react. Now I completely understand why the
Mm-hmm.
reaction causes
Mm-hmm.
what it causes in some patient, because
Mm-hmm.
they in 5 seconds I can really notice in 5 seconds their whole history about many things that happen in their lives. They realize, look, wow, this is exactly what happened to me. This is why I lost the patient. This is why I felt awkward with the patient. This is why there was no rapport with the patient.
Mm-hmm.
And when
Mm-hmm.
when they realize that, then a whole new world opens.
Mm-hmm.
But
Mm-hmm.
yes, I do use some not very orthodox examples, and
Mm-hmm.
I'm
We're,
more than happy to
we're going
talk
to do an
about that.
episode on that because I think it's very interesting, and also
It's funny
what
also. It's very funny also.
yeah, and also because what you said is true. When dentists start to gain some self-awareness, and when dentists start to hear us talking about, I have exactly the same feedback as you, is that when they realize then there's a lot of things going on that it's they are not understanding, because then they just blame the patient, it's just what the patient expectations, and patients, they're huge. The major stress cause of dentists are patients, but what dentists
Yeah,
are missing is that they are reacting to the patients, and
yeah,
if they don't develop the self-awareness, there's
exactly.
a lot of things that they are missing,
Yes, there's a
and
lot
then
of things.
they are just focused that the patient didn't go with that treatment plan, or this or that, and they don't realize the
Yes,
energy, they don't
yes,
realize the
yes,
reaction, they don't
yes.
realize. So so I think even if the conversation sometimes have uh, uh, the some people are a little bit surprised that we speak about these things, but
It's very
they are a
helpful. It's
big part,
extremely helpful of
of what's
life
happening,
and
and of
interaction.
what's
Yes,
happening
yes,
in an appointment. They
yes,
are a big part
yes,
of the
yes,
appointment. So I think
yes.
it's very important. Okay, so
And it's very
let's talk
simple. I
about
think that
that.
once you grasp it, I think it's very simple. Yeah,
Mm-hmm, mm-hmm,
and you
yeah, and it's
can
all
learn from
connected.
there.
It's all connected. I mean,
Yeah,
non-reactive behavior with emotional intelligence, with
mindfulness.
self-awareness, with mindfulness. It's all connected. So
Yeah.
I think it's. Okay, let's talk about it in the next episode.
Let's not
Let me
spoil
just
it.
yeah, let me just finish by saying that a lot of what you said today, you give all this information and all this the all the system and
Templates,
the
the
checklist and the
templates.
templates.
Yeah,
You give
all the
all
written
of that in
protocols.
our you give you give all of that in our conscience leadership course that is going to
Yeah.
happen in the south of Portugal, in Sagres, in October. If you want to
Yes.
know more, just go to softbites.online. There's all the information is there. And
Hmm.
also, if anyone has any questions, or if you want to get in touch with us, just send us an email or a message. And thank you again, Andre, for all your
Thank you so
generosity and
much.
for being so honest and
Thank you so
so
much. And
open
no,
about
and
everything.
thank
I
you.
really enjoyed the conversation. I think it
Yeah,
was a really good
and
one.
thank you for making me think about these things and making me think about ways to simplify it and to deliver it in a more productive way and a more helpful way for the people that listen to us or the people that do the courses to us. So thank you so much for bringing out of me all these things that can eventually be helpful. And I've been learning a lot when I talk to you. There's a lot of things that I miss, especially mindfulness and emotional intelligence and stuff like that. So that's a whole. So I'm very good at systems, but there's a whole new other level which I am learning, and I'm really a work in progress. And you have been helping me a lot.
Oh, thank you. So nice to hear. I really, because I really enjoy our conversations, and I also
Yeah.
learn a lot. And again, it's it's in 21 years of dentistry, and I don't know if you have the same experience or not, but this kind of generosity that you have and this kind of mindset that you have of giving and believe in the deep belief that you know that you have, that you gain more than you give, and that's enough
Yeah.
for everyone. You don't see it that often in dentists.
Well, there's a
So
saying that says that the only love that really stays is the love that you give.
mm-hmm, mm-hmm.
So
Yeah,
I
and you give it, and you give it. You know,
yeah.
I was very touched the last time that we spoke, because we didn't speak for a few weeks, because I had a busy schedule. And the first thing that you said was, "Oh, I missed you. I missed you." So it was
So
such a nice thing.
why
Thank
shouldn't
you.
I say that?
Yeah,
Why shouldn't you
it's
say these
true.
things?
It's true, and I it stayed with me. So yeah, so thank you so much. It's been a joy and a real pleasure,
Yeah.
and thank you for everyone for listening and for the good feedback, and we'll be back next time. We're going
Yes,
to
we
talk
will be
next time.
back
We're going
next
to talk
time.
about emotional intelligence in dentistry.
Nice, nice, nice.
Okay, bye bye
Okay, Manuela. Bye
everyone.
bye.
Bye
Bye
bye.
bye.